Today we will be dealing with the study of snakes and Ophitoxemia, its medico-legal aspects. It is a vast topic. We will be dealing and limited with the medico-legal aspects of snakes and Ophitoxemia. Now, you know the snake bite, all over world is there, snake bite, and there are about 1,25,000 deaths per year. This is whose estimate, WHO estimate, 1,25,000 deaths are there in 1 year. So, snakes are of various categories, and there are 3,500 species of snakes. According to the CBME, it is a competency number 11.1, that is snake bite. There are 3,500 species in the world, out of which 250 species are poisonous. In India, there are 216 species found, and out of which 52 species are poisonous. Snakes can be broadly divided into poisonous snakes and non-poisonous snakes. You will find in India the snake bite is very common in the villages and particularly in rainy season. Now, what is the classification of poisonous snakes? The poisonous snakes are classified into 5 families. The first family is Viperidae. There are 2 subfamilies in Viperidae. A is Viperini. Examples are Russell viper, saw-scaled viper. B is Cortellidae or pit vipers. The examples are pit vipers, copperheads, rattlesnakes and bushmasters. Elapidae family, the examples are cobra, kraits, mambas, tiger snakes, taipan, death adder, coral snakes. And Hadrophidae family, sea snakes. All sea snakes are poisonous, but they seldom bite. So, you will find that all sea snakes are poisonous, but they seldom bite. The Colubridae family, the examples are boomslags, bird snakes. In the Atracta spididae family, the African and Middle Eastern burrowing asp or stiletto snakes, also known as burrowing or mole vipers or adders or false vipers. The commonest Indian snakes are, remember all of you, commonest Indian snakes are big 4. First is common krait, second is common cobra, third is saw-scaled viper, and fourth is Russell viper. So, every student must remember these 4 snakes, common poisonous snakes in India. Of these 4 common snakes, anti-snake venom is prepared. It is called as polyvalent anti-snake venom. This polyvalent anti-snake venom is prepared in Hopkins Institute, Bombay, in Chennai, in Pune and Kausali. In 4 cities in India, the anti-snake venom is prepared. So, there are differences between poisonous and non-poisonous snakes. So, you will find these differences, the belly scales. In case of the poisonous snakes are large and cover the whole width, but the belly scales are small in non-poisonous snakes, small to moderate in non-poisonous snakes. Head scales are small in vipers. What is the difference between poisonous snakes and non-poisonous snakes? Now, see that head scales are small in vipers, however, there are few exceptions. In pit viper, there is greenish pit between eye and nostril. In cobra and king cobra, the third labial is large and touches the eyes. Remember this sentence for MCQ. In cobra and king cobra, third labial is large and touches the eye. In krait, the central row of scales on the back is large and fourth infralabial is very large. In non-poisonous snakes, the head scales are large. The fangs is very important differentiation. The fangs are present in poisonous snakes. They are canalized in viper and grooved in colubrine snakes or cobra. Remember, this is for MCQ, canalized in the viper and grooved in case of cobra or colubrine. The fangs in non-poisonous snakes are usually absent. If they are present, they are solid. Tail is compressed in poisonous snakes and not so in non-poisonous snakes. Generally, the poisonous snakes has the habit of nocturnal habit, but in non-poisonous snakes are not so. Bite mark shows two fang marks and there may be present the marks due to other small teeth in colubrine. There is no fang marks in non-poisonous teeth, non-poisonous snakes. Saliva is toxic in poisonous snakes and saliva is non-toxic in non-poisonous snakes. Now, what are the features of common poisonous snakes? Common poisonous snakes, we will have the study of features of common poisonous snakes. The commonest is cobra. Saap, it is also called as saap, kala saap or nag, and usually villagers and common word is nagin. Nagin is female word. Nagin, nag and nagin. So there are male varieties, female variety also. Then color is grey, black or yellow. Hood is monocellate, binocellate or black. I will show you on the photograph what is monocellate, what is binocellate and what is the black. The spectacle mark, I will show you on the photograph what is the spectacle mark. Dorsum of the neck or big oval spot, two black spot and there are three bands on the ventral side in case of cobra. Third labial shield is the biggest and there is tiny triangular shield, base shield between fourth and fifth infralabial. In king cobra, you will find that in king cobra the length is usually 18 feet, highest length. It is also called as Raj Sap or it is king cobra. The color is yellow, green or brown, black. The yellow or white cross bars are across the body or dorsal surface. This is king cobra. I will show you the photograph. This is king cobra. See the hood of king cobra. So they are of the length of about 18 feet and you will find that they reside in the forest, deep forest. So these are the hoods of cobra. This is binocellate. This is also called as spectacle mark. See this spectacle mark, binocellate. This is black head and this is monocellate. This is one rounded mark over the dorsum of hood. So this is the ventral surface of the hood. You are finding dark spot and these are the bands. So this is again a photograph of cobra spectacle mark. So these are the fangs of viper. Fangs of viper are stout than the fangs of cobra. Fangs of viper are about 2.5 centimeter length in case of viper and 1.5 centimeter length in case of cobra. Remember this for MCQ. Now coming to the viper, the study of viper, the Russell viper, it is also called as Ghonas in Marathi, Kandir in Hindi, charm viper, then length is about 5.5 feet. The color is light brown. Head scales are small like body scales and you will find V-shaped mark on broad head. I will show you on the picture. V-shaped mark, remember V-shaped mark on viper. 3 rows of diamond-shaped brown patches on the dorsal surface. Diamond-shaped scales are there on the viper, 3 rows. This is Russell viper, you are finding this is V-shaped mark. V-shaped mark, the diamond-shaped, the scales are there on the dorsum of the body. So this is Russell viper. There are 2 categories in viper you should remember. Russell viper, major categories. Russell viper and saw-scale viper. Then pit vipers etc. they are, you need not remember. Then saw-scale viper, it is also called as in local languages Aphai ichis. The length is 1.5 feet. It is brown in color. Triangular head is there. Head scales are same as on the body. Bird foot mark on the head. 2 wavy lines on the flank with diamond shaped darker areas between 2 lines. I will show you the 2 lines on the photograph. Then pit viper is green pit viper, pit between eye and nostril. Now here you see the wavy line. This is wavy line on the side of the belly. This is wavy line and the scales are saw scaled. The teeth-like appearance on the scales, saw scaled. Saw has the teeth and you will find the teeth-like appearance of the scales. And here you are finding saw scaled viper. It is a bird footprint mark on the head. Bird footprint mark on the head in case of saw scaled viper. This is again a picture of saw scaled viper. The scales are very prominent here. Scales you are finding, these are the, this is wavy line and these scales are serrated or they are called as saw scale. They are tooth-like. Listen here, see the photograph. Every student must identify these 4 snakes. Every student must identify these 4 snakes because usually the poisonous snakes are killed when it is bitten to the particular person and they are taken to the doctor whether this is a poisonous snake or not. So, you must identify at least 4 snakes: cobra, krait, viper, Russell viper and saw scaled viper. These are 4 commonest snakes in India. Every student must be able to identify. So, this is green pit viper. This is also poisonous. There is pit between eye and nostril. Then common krait. Common krait is also called as maniar and kavaria. In local language, length is 5 feet. The color is shining steel black color, steel black or blue color. There are 4 pairs of infralabial shields. There are single lined or double lined white arches on the dorsum surface of the beginning from some distance of the head up to the tail. So, these are the arches. Do not call it as a band. I will show you the photograph. So, these are the arches you are finding here. So, do not call it as a bands. Then you are unable to differentiate between banded krait and the common krait. This is common krait. Call it as a arches and this is steel blue color or steel blue black color, common krait. The commonest poisoning in India is because of common krait. Remember this sentence. Commonest poisoning snake venomation in India is the common krait. Then banded krait, length is about 7 feet. The banded krait is also called as Ahiraz coelia in local language. Then length is 7 feet. There are alternate yellow and black bands of 2 inches broad. Sea snake's tail is fin-like. Tail is fin-like or flat. Snout is present on the head through which it respires. The skin is tuberculated and it is myotoxic. Remember this particular sentence, myotoxic. It is myotoxic. This is banded krait. You are finding these yellow and black bands about 2 inch in breadth or width and this is a poisonous snake, banded krait. Then this is the example of sea snake. You are finding this. This is the flat tail. And here you are finding this is snout where from it respires snout. Snout is over the head. Then coming to the snake venom. What is snake venom? Snake venom is also called as saliva. It is clear amber colored digestive juice of the snake. In right form it is crystalline soluble in water. It contains proteolytic enzymes, fibrin ferments which enhance or enhance the coagulative process. Neurotoxins are there. These are the toxins, various toxins and enzymes in the snake venom. You remember, neurotoxin is there which causes paralysis. Cholinesterases are there which causes the impairment of neuromuscular transmission. Hemolysins are there mainly in viper which is hemotoxin. Which causes hemolysis of the blood and hemorrhage in the tissues. Cardiotoxins mainly in cobra. They are cardiotoxins which act on the heart. Then the cytolysins mainly viper causes, it is mainly in viper causes lysis of the blood, lysis of the cells, blood cells. Agglutinins which causes agglutinin of the RBCs. Then lecithinase. Lecithinase causes lysis of lipid layer of endothelium. Then phospholipase ABCD causes hydrolysis of lipids, and phosphatidase which causes hemolysis. Then proteinases which causes dissolution of vascular wall. Then the enzyme is hyaluronidase which causes the spreading of the venom, spreading of the poison. Ribonucleosis also helps in spreading of the venom. Ophioxydases which helps in the autolysis of the cells. Then proteases which causes dissolution of vascular wall. Then the biological amines, histamine, local pain will be there because of histamine, 5-hydroxytryptamine, histamine, these are biological amines. Then peptides and polypeptides causes systemic effects. So these were the various enzymes and toxins present in the snake venom. Usually in Viva the question is asked, what are various enzymes, what are the toxins in snake venom. Now snake venom poisoning is called as Ophitoxemia. Now what are the symptoms of Ophitoxemia? The symptoms of Ophitoxemia depends on the type of snake bite, age of the person, size of the person, health of the person, site and bite on the patient. Then the size of the snake and type of snake is also important. Cobra bite, what are the signs symptoms of cobra bite? There is very much curiosity about the general public about the cobra, because the cobra is shown by the various madaris and the hood is there. In cobra, remember the hood is there. Whenever the difference between cobra and viper is asked, you must tell that the cobra has hood. So cobra is having the hood. The sign symptoms are burning, tingling, numbness, redness, irritation, swelling, inflammation after 15 to 2 hours after the cobra bite. So there is burning sensation over the site of bite, tingling, redness will be there, irritation will be there, swelling will be there, inflammation will be there within 15 minutes to 2 hours. The ptosis is the earliest neuroparalytic manifestation followed by ophthalmoplegia. What is ptosis? Ptosis is drooping of eyelid is called as ptosis. You will get this ptosis in cobra bite. This is the earliest neuroparalytic manifestation of the cobra bite. Remember, every student must remember this ptosis sign. And then there is a giddiness, muscular weakness, drowsiness, nausea, vomiting, paralysis of limbs, trunk and other parts of the body. Saliva in mouth. Now what is the meaning of expression of saliva in mouth? Saliva though it is always there in mouth, but there is dribbling of saliva. He cannot hold the saliva in the mouth. Why he cannot hold the saliva in the mouth? Because of paralysis of facial muscle. He cannot hold the saliva in mouth. In lay people, what they test? Villagers, they usually give some bitter things to taste. If he does not taste bitter thing, that means poisoning is going on. So like that there is a small test, villagers test. Saliva in mouth, usually dribbling from the mouth. It is because of paralysis of the facial muscles. Then consciousness is there but unable to speak. Why unable to speak? Again because of paralysis of the muscles. Then the coma is there set up, and finally respiratory paralysis is there. So this was about the cobra bite. Now coming to the viper bite. In viper bite there is severe pain at the site of bite. Onset of swelling starts within 15 minutes. Swelling, ecchymosis is there, oozing of serum through the site of bite is there. There is vomiting, hematuria may be seen within few hours of bite, and there are signs of shock. Unconsciousness develops within 1 to 2 hours. There is hematemesis. Hematemesis because of it is hemotoxic. Hematemesis is there, hemorrhage is there, hemorrhages through orifices. Then local suppuration will be there, sloughing will be there, gangrene may occur, edema, tetanus and death due to septicemia may occur in viperine bite. Now coming to the snake venom and its fatal dose and the yield of snake venom. The fatal dose of snake venom in case of cobra, the fatal dose is 12 milligram of fatal dose. You remember for MCQ. Then for viper it is 15 milligram fatal dose. For ichis it is 8 milligram fatal dose. For crate it is 6 milligram of fatal dose. The average yield of venom in one bite in terms of dry weight in cobra 170 to 325 milligram. In Russell viper it is 130 to 250 milligram. In ichis it is 20 to 35 milligram. In crate it is 20 milligram. So fatal period in cobra is half to 6 hours. Remember this. In cobra it is half to 6 hours, and in case of viper 1 to 2 days. Remember this delayed period in case of viper 1 to 2 days. I will give you one example, it is very important example to differentiate between this poisoning. So I will give you in the last. Then coming to the diagnosis. The diagnosis can be done by the snake if the snake is brought killed by the patient or patient's relative. So you can very well support the diagnosis by that. Then identification of the fang marks. Fang marks should be identified, which helps in diagnosis. Identification of snake is very important. Lab investigation like hematological investigation, ECG, metabolic investigations, urine, renal, chest X-ray, X-ray of the bitten part is very important. Immunodiagnosis is very important. Immunodiagnosis, radioimmunoassay is most sensitive. Radioimmunoassay is most sensitive. It is sensitive up to 0.4 milligram per liter detection. Then enzyme immunoassay is also sensitive. It can detect up to 5 milligram per liter. ELISA in body fluids is also done. Body fluids like CSF, body fluids collected from the body and the washings collected from the site of bite, then tissue extract collected which can be used for ELISA testing. The extract injected into the frog for toxicity, and you can know the toxicity of the snake venom. So this is the cobra bite, you are finding here the bite mark here. The minimum local effects are there in cobra bite. Remember that in cobra bite there are minimal local effects. This is the late sign in case of cobra bite, late effect, necrosis at the thumb. Then ptosis in cobra bite is the very important sign in cobra bite. You see the ptosis, and this is the cobra. Killed cobra does not have hood. Remember that the king cobra does not have hood. This is the example of the photograph showing viperine bite, the hematemesis. Because of viperine bite, the patient developed hematemesis. And this is the hematuria, the blood in urine because of the snake bite. Within 1 hour, 1 to 2 hours you get hematuria. So you collect the urine and see that hematuria is there or not. That signifies the viperine bite. Then what is the difference between colubrine snakes and viperine snakes? The other type of question here is asked, what is the difference between cobra and viper? Colubrine snake and viperine snake. The colubrine snake, the head width is same as the body, but in viperine head is broader. The neck in the colubrine is absent, hood in cobra is there. In viper, the neck is distinct. The scales on the head in colubrine is bigger than the body scales, but in viperine, the small and same as the body scales. The pupils are circular in colubrine snakes. The pupils are slit-like or vertical in viperine snakes. The teeth you will find present with the fangs in colubrine snakes. Only poisonous fangs are present in viperine snakes. Poisonous fangs are grooved, smaller and delicate in case of colubrine. This is repetition again, you must remember. The canalized, longer and strong fangs are there in viperine. Then offsprings in colubrine, they lay eggs, oviparous. Viperine, they give birth to the young ones, that is viviparous. Poison is more neurotoxic in colubrine and hematotoxic in viperine. So, this is the difference between colubrine and viperine snake. In examination, it is usually asked, you should know the major differences. Then coming to the treatment of snake bite. So, this we are talking about the principles of treatment. We are not going into the very much details of the treatment. Allay the anxiety of the patient. Say that all snakes are not poisonous. The snake bitten to you may be non-poisonous snakes, and even if it is poisonous, it may not have injected the whole venom to you. So, don't go in anxiety. Then apply tourniquet. Application of tourniquet, there is a particular method of application of tourniquet. We should block the venous flow, but should not block the arterial flow. Then it should be released after every half an hour or 1 hour. Then wrap bandage. Wrap bandage is nowadays, it is a tight bandage. So, it will also be bandage over the bitten part and above that particular part, but it is not indicated in viperine bite. Why it is not indicated in viperine bite? Because there is much swelling, and in case of viper it is hemorrhagic. Therefore, it is not indicated in viperine bite. Clean the wound. Prevention of spread of venom. Previously suction was done, but it is nowadays not very much recommended, because very small amount of poison is being taken out by suction. Then prevention of spread of venom. Immobilize the patient. Patient should be immobilized. The particular movement are to be immobilized. Use the anti-snake venom. Treatment is using of anti-snake venom. Whether the sensitivity test should be done, if you find in old books, sensitivity test is very much recommended, but new books, they are not recommending sensitivity test. Why? Because it is not very much confirmatory, and it will not, it is a poor indicator of anaphylactic reaction. Because of this sensitivity test is poor indicator. And even if the sensitive patient is there, hypersensitive sensitive patient is there, one has to administer the anti-snake venom, right? Therefore, it is not advocated nowadays. Desensitization should be done by 0.5 to 1 ml subcutaneous injection of the anti-snake venom. Then IV 20 ml of polyvalent anti-snake venom is given, repeat whenever it is necessary, 2 hours every 6 hours till the recovery is there. Then in viper bite, local injection of anti-snake venom around the site of bite should be given. Then analgesic for pain can be given. Subcutaneous adrenaline, if allergic reaction is there, subcutaneous adrenaline can be given. Steroid, antibiotics, antihistaminic, tetanus toxoid can be given. Then in case of cobra bites, 0.6 milligram of atropine and 0.5 milligram of neostigmine can be given in cobra bite, and in viperine bite, heparin should be given. Then the peritoneal diagnosis is also indicated, hemodialysis, ventilatory support is indicated as per the particular ICU treatment. Then polyvalent anti-snake venom. How much polyvalent anti-snake venom is given? There is certain regime. So, the regime one should know. So, regime is that when the minimal symptoms is there, then you will give 5 vials. Minimal symptoms means local swelling but no systemic reaction. So, 5 vials can be administered. Moderate symptoms, swelling progressing beyond site of bite with systemic reaction, 10 vials can be given. In severe cases, marked local reaction is there, severe symptoms are there, then 10 to 15 vials are to be given. Each vial of polyvalent anti-snake venom neutralizes 6 to 8 milligram of snake venom. how much snake venom can be neutralized by polyvalent anti-snake venom? Polyvalent anti-snake venom can neutralize 6 to 8 milligram of snake venom. Then post-mortem finding, 2 lacerated punctures 1.25 centimeter deep in colubrine and 2.5 centimeter deep in viperine bite. Examine under lens. At post-mortem you must have the lens. You examine this under lens. Then swelling cellulitis, signs of hemorrhage at the site of bite is there. It should be examined properly. Signs of hemorrhages through natural orifices. Blood extremely fluid and purple, usually in case of viperine bite. Internal organs are congested and hemorrhagic. So these are the post-mortem signs in case of snake bite. So this is the case where this particular case of viperine bite was brought to us for post-mortem examination. The particular patient was dead after 4 days of bite. He was treated there at the village and he was asymptomatic. He said that he had only swelling to the feet and there were no other symptoms. So he remained there in the village for 1 day. Then somebody told that you go to some center, big center and go there. So in big center, district place he has gone and there he said after 24 hours anti-snake venom will not work. And then the treated conservatively and then died after 4 days. So I have done the postmortem and I have taken these photographs. You are finding in here that bite mark. So here this is the bite mark with the blister and there is hemorrhages. The discoloration is because of hemorrhages and this is incise and here you are finding the hemorrhages in the tissues. So this is because of viperine bite. The mistake is done at the level of ignorance and they feel that nothing will happen, but every medical officer, every small doctor, he should know that the swelling and cellulitis is a symptom of envenomation. So this sentence remember, swelling and cellulitis is the symptom, sign of envenomation. So these are the internal hemorrhages in this viperine bite. Internal hemorrhages, peritoneal hemorrhages is there. Then what is medico-legal importance? Accidental poisoning is very common. Accidental poisoning, snake poisoning is accidental poisoning. Suicidal and homicidal are rare. The suicidal case in the history is there, the history of Cleopatra. The Cleopatra, she was the queen of Egypt and she has committed suicide by snake bite. So that is the example in the history and homicidal is very rare. Cattle poisoning can be there. There is special way of cattle poisoning. What is special way of cattle poisoning? The snake is kept in the earthen pot. The banana is kept in that earthen pot and then the pot is heated from below. Because of irritation, that particular snake bites to the banana and the venom is injected in the banana and that banana is kept in the split bamboo. Split bamboo, that banana is kept and then introduced into the rectum of the ox or cow or buffalo, whatever the cattle poisoning is required. So that was the way of poisoning, cattle poisoning. Snake venom is non-poisonous by mouth. Remember this sentence, snake venom is non-poisonous by mouth. Preserve the skin with subcutaneous tissue around the site of bite for FSL. So this you send for FSL, you can also send the blood with the serum is required for the FSL. And in case of the clinician can keep the saline washings from the site of bite and send it to the forensic science laboratory or where there are the facilities. These are the references from Pillai's book, from Narayan Reddy's book, Agrawal's book and Singhal's toxicology book major. The other books were also referred and this is in short about the snakes and Ophitoxemia. We have covered the classification of snakes. Then what are common snakes in India? What is polyvalent anti-snake venom? What are the features of common snakes in India? What are the features of toxicity and venomation of common snakes in India? Treatment of it, clinical features, treatment, postmortem appearances, and medico legal importance. So every student must know that.
Thank you very much.